Hello everyone, Shunmei Medical is here to introduce to you a procedure of neurovascular surgery and the method of using the device for intracranial thrombectomy. First, we introduce the demonstration model. This is the femoral artery, which is also a commonly used puncture site. Up here, we call it the iliac artery, and after the two iliac arteries are combined, it becomes this whole aorta. Let's identify the aorta from the bottom up. The abdominal part is called the abdominal aorta, the thoracic part is called the thoracic aorta, and then the upper part is called the aortic arch. Then, go up from the aortic arch, and you can see these two carotid arteries. Continuing up along the internal carotid artery, you can see the branch point. Towards both sides of the brain is the middle cerebral artery, and towards the middle of the brain is the anterior cerebral artery. Then, there are two vertebral arteries which merge into the skull to form the basilar artery. The following is the introduction to puncture procedure. Puncture is performed with introducer sets, which is mainly composed of introducer sheath, dilator, introducer needle, and guide wire. First of all, insert the introducer needle for puncturing and introduce the guide wire along the introducer needle. Then, withdraw the introducer needle. Introducer sheath and dilator need to be combined and inserted together, so the dilator is inserted into the introducer sheath first. After the combination is completed, it is introduced into the human body along the guide wire. After the insertion, remove the guide wire and dilator, thus establishing a channel between the inside and outside of the body. Next, we will insert a PTFE-coated guide wire, usually a 0.035-inch PTFE-coated guide wire. The guide wire is introduced into the body through the introducer sheath and continues to go up to the internal carotid artery. Then, the guiding catheter is inserted. After the PTFE-coated guide wire is in place, the guiding catheter is introduced along the guide wire and up to the distal position of the C1 segment of the internal carotid artery. Once the guiding catheter reaches the position, withdraw the PTFE-coated guide wire and replace it with the neural micro guide wire of 0.014 inch. Then, insert the micro guide wire into the desired position. In thrombectomy, it is a good choice to use a balloon guide catheter instead of guiding catheter. The balloon guide catheter has a wide-type hub at the proximal end and a balloon at the distal end, which can be inflated to temporarily block the blood flow during thrombectomy to prevent the thrombus from escaping. The balloon guide catheter is introduced into the same position as the guiding catheter. Next, insert the intermediate catheter. There are many names for intermediate catheter: intracranial support catheter, distal access catheter, distal access guiding catheter, and aspiration catheter, all of which refer to intermediate catheter. Through the micro guide wire, the intermediate catheter goes up from the inner lumen of the guiding catheter, advanced to the desired position to be fixed. Let's demonstrate the process of thrombectomy. Let's take a look at the intracranial embolization stent, which is coiled inside the coil tube, and then take it out. The first thing we see is the pusher at the proximal end, followed by the loading tube, and then the intracranial embolization stent at distal end inside the loading tube. And there are radiopeg markers at the front and back of the stent. The intracranial embolization stent is delivered into place by microcatheter. First, insert the microcatheter along the micro guide wire. We assume that the thrombus is at this position. Insert the microcatheter and the micro guide wire to the front of the thrombus. Continue to push the micro guide wire and microcatheter. The microcatheter passes through the thrombus and fix the microcatheter. Then, we withdraw the micro guide wire, and then deliver the intracranial embolization stent into place through the microcatheter inner lumen. Next, release the stent. The stent is fixed when released. Then, withdraw the microcatheter so that the stent will be deployed at the thrombus site. Wait a few minutes for the stent to catch the thrombus. Then, pull back the stent and microcatheter into the intermediate catheter. While the intermediate catheter is given negative pressure for suction, and the intermediate catheter was withdrawn from the body by maintaining the negative pressure. Then, withdraw the other devices in turn.